Dr. James Pickney II, board-certified family medicine physician. Dr. James, he studied general surgery at the prestigious Cedars-Sinai Medical Center in L.A. After graduating from Baylor College of Medicine in Houston, he's the founder of this service, Diamond Physicians, which is basically a one-on-one, you and your doc and nobody else. They bypass Obamacare. They bypass the traitorous insurance companies. And he's really my go-to guy to talk about all things concerning Obamacare and alternatives to it. Dr. James, thanks for taking time out from the family on this Thanksgiving Friday to be here on the Jay Severin Show with me, Chris Salcedo.
Oh, it's my pleasure, Chris. Thanks for having me on the show.
After our last conversation on the radio a couple days ago, a young lady called up and said, you know, if we have Obamacare insurance, why would we partake in Dr. James' service? And I said, well, the assumption is that, you know, a lot of folks can't afford Obamacare because it's just skyrocketing costs. And that's the reason why you would look up an alternative to mainstream insurance-provided health care. Do I have that about right?
Yeah, that's half of it, Chris. The main reason is because if you do have an Obamacare plan, whether it's the bronze, the silver, or the gold, you have access to health insurance, but you don't have access to health care, which is the most important thing. Doctors aren't accepting the Affordable Care Act plans. I can give you example after example of patients that signed up on the exchange and can't find a primary care doctor.
Yeah, and you know what? And I also brought up, too, where I said, you know what, may be economically feasible in these early days of Obamacare because the penalty is so low, is you could pay the penalty and go to a practice like Diamond Physicians and still come out ahead of where you would be had you decided to pay for Obamacare.
You know, that's right. And the crazy thing is that they don't have a means to enforce that penalty. So if you are owed a tax refund, then they can take funds away from your refund, but they can't levy the penalty.
I see. Dr. James Pickney is my guest right now, Diamond Physicians. So you heard me mention there's a likelihood that Obamacare could be in for a death spiral depending on how the Supreme Court rules, and we should find out in the summer of 2015 how this goes. But let's say, for argument's sake, that the high court gets some sanity and says, well, yeah, the law does mean what it says. That means a lot of folks who live in states who did not create an exchange are not eligible for federal subsidies. Hence, it will cause the death spiral here of Obamacare. Folks are going to be looking for alternatives. Why is your model superior to what's out there?
You know, Diamond Physicians was built on the premise of providing truly affordable health care at an affordable price and at a whole nother level than we're currently servicing in our medical industry. When you walk into your doctor's office, you wait for at least 30 to 45 minutes. Then they stick you in a cold, dark, sterile exam room, and you wait for another 30 minutes, and you're wondering where your doctor is. If I showed up to a business meeting and was 45 minutes late, no one would do business with me, and they wouldn't ask me back. But we keep accepting this very poor medical care in our society, and Diamond changes all that. So when clients walk into a Diamond Physician's office, they're greeted by me personally. I greet my clients in the reception area. I take them back to my personal office. We sit, we chat, we catch up. The average doctor visit is 8 minutes. The average Diamond visit is 60 minutes. So after I catch up with each client, then we go to the exam room. I do my exam. Then we go back to the office and we talk about how we're going to move forward, how we're going to alter lifestyle, what medications I'm going to use. And then I answer all your questions. So it's completely different and more efficient than our current model. And the pricing structure is unbelievable, Chris. $45 a month for kids, unlimited visits, no copay, 24-hour access to your doc via cell phone, email, or text. And adults start at $95 to $295 based on age.
Now, when you have conversations with folks in the medical profession who are still plugged into the old HMO system, which, by the way, was another gift to America from the Democrats. Ted Kennedy was the author of this. And now, a few years later, you fast forward, and now that's collapsing. Obama says, trust Democrats again, and we'll give you Obamacare. And it looks like that's going to fail. That's an aside. But when you talk to other physicians and you tell them, say, this is the way we provide service at Diamond Physicians, what is the feedback that you get from doctors most often?
They're blown away. They're like, wow, there's a better way. because doctors are fed up. They're exhausted. Primary care is dying, Chris. There are practices closing all over the country or either being bought by big hospitals because they can't keep the doors open. I'll give you an example. Blue Cross Blue Shield, a flu test, an influenza test cost me $13.40. Back in the days when I took insurance, they reimbursed me $4.80 for that same test. I'm losing money. You cannot operate a business like that.
Right.
So with our model, physicians they're overwhelmed because it's a win-win-win for everyone. They get to spend more time with their patients, they get to spend more time with their families, and they make more money.
Yeah, there was a news report from, I think it was California, that had described that some of the, and again, Obamacare was also a Medicaid expansion, folks, and those who take Medicaid, and some doctors are actually having to pay their patients, I think it was like $1 or something like that, to see them. That's a losing business model when the doctor has to pay to see patients. You don't stay in business very long with that dynamic, do you?
That's exactly right. It's unsustainable. The cost of healthcare is rising at twice the rate of inflation. We spend the most money out of any industrialized nation in the world, and we're 17th on the list as far as how strong and efficient our healthcare is. It makes no sense. We have to change, and Diamond Physicians is the solution to the largest healthcare crisis we've ever seen.
Dr. James Pickney, the second, is my guest right now from Diamond Physicians. I've got about 45 seconds left, but do you think that this model that you are doing and some other entrepreneurs are doing out there will one day be the solution to skyrocketing healthcare costs, eliminating the folks I call the traitorous insurance companies, and setting America back on the track toward providing superior medical coverage?
I'm 100% confident that it is. Starting January 1, 2015, we are launching a nationwide initiative to have a Diamond Physicians practice in every city in the country. Our goal is to provide affordable health care to every U.S. citizen, so we're looking for investors, physicians, anybody that wants to introduce competition to the market, cost transparency, efficiency, and turn this thing around.
All right. Diamond Physicians, the name of the practice. If you folks are interested, where can they go, Dr. James, to check out what you guys do at Diamond Physicians?
Yeah, go to diamondphysicians.com. You can follow me on Twitter at @the_Dr. James, or send us an email at info@diamondphysicians.com.
Have a great rest of your Thanksgiving weekend, and Merry Christmas to you, Dr. James, if I don't talk to you before then.
Oh, thank you so much. Same to you.